Hope your Tuesday's off to a great start. I'm Michael Aaron here with meteorologist Nathan Scott over in the Weather Center. This morning is really shaped up to be nice as we head into this Tuesday afternoon.
It was cold out there this morning.
It was.
We start off the day into the 20s, but we've made a nice recovery. All that sunshine across central Arkansas, Michael. Look at these numbers. Warming up to the upper 40s, even some low 50s showing up on the board. Little Rock, Hot Springs, also Mena, and the temperatures will continue to climb through the course of the afternoon because we're going to hang on to that brilliant blue sky. Highs today, upper 50s for South Arkansas, probably mid 50s here in most of central Arkansas. I'm going for a high of 56 in Little Rock, 56 in Hot Springs. Tonight will not be as cold. I think most locations will stay above 30 degrees. We'll call it low 30s, maybe some upper 20s in those colder spots. Now going into the rest of the work week, temperatures will start to warm up. However, I'm watching out what's happening for Friday night and into Saturday. There's some new information on this system, and it does include the potential of maybe some winter weather for parts of the state. I'll have more on that coming up.
Later this afternoon, Governor Asa Hutchinson will update the public on the state's current COVID surge. She's expected to address several things. That includes help for our hospitals and the state's first shipment of at-home tests. And those tests are needed as the Omicron variant continues to drive up cases. When we look at the last week, Arkansas is averaging almost 6,800 new cases per day. Let's put that into perspective. Before this Omicron surge, 4,304 was the highest number of COVID cases we ever saw in a single day. And that was back on December 31st of 2020. While we've heard that Omicron is less likely to cause serious illness compared to the Delta variant, which caused our summer surge, hospitals aren't in the clear. Just in the last 2 weeks, we've seen hospitalizations double from 519 to over 1,000 now. The troubling trend is causing some concerns about whether hospitals will have enough space for patients in the coming weeks. And now state leaders are considering allocation of federal funds to help. The state's American Rescue Plan Act Steering Committee met yesterday to decide on adding 265 hospital beds shared among 11 hospitals. Those include Baptist Health, Conway Regional, CHI St. Vincent, and Arkansas Children's Hospital. The move carries a $50 million price tag, and it passed the committee unanimously. The proposal shows hospitals will use existing staff for the additional patient beds, but with staffing shortages and healthcare worker burnout already an issue, the Arkansas Nurses Association is asking lawmakers to consider those people on the front lines.
Anything that we can do to, offer direct support to them is much needed.
So that measure now heads to the legislative committee. If passed, that's when the hospitals will get those additional beds. We'll keep you updated. Meanwhile, Arkansas just received a big boost to help all the people looking to get a COVID test. Maybe you're one of them. The governor announced we've received 211,000 of the 1.5 million at-home COVID testing kits the state ordered from the federal government. The National Guard will help deliver those kits. They'll be available at local libraries and public health units across the state. Rapid tests, PCR, antibody, we know all these different types of tests can be confusing, so let's get some clarity on this. Evan Kosloff verifies which test you should use and when.
Finding a COVID test has been really difficult for a lot of us, but if you can get your hands on one, there are two different kinds that you might be able to choose from: a molecular PCR test and a rapid antigen test. So let's verify, when's the best time to use each one? We took that question to these three experts: Dr. Amish Adalja, Dr. Gigi Granval, and Dr. William Maurice. First, let's break down what makes these tests different.
There's really two things when you think about a test. There's specificity and sensitivity.
That's specificity. If you get a positive result, what's the chance you actually have the virus? And sensitivity. If you have the virus, what's the chance that you get a positive result?
We know the antigen tests most of them are quite specific still, but they are somewhat less sensitive.
Here's the big difference. PCR tests are so sensitive that they'll catch even the smallest amount of virus before and after the time when you're contagious.
PCR positivity does not correlate with contagiousness. Antigen tests will become negative as soon as someone's viral load or viral shedding drops below a threshold that's associated with contagiousness.
So, when should you take each test?
If, let's say you've been exposed and you don't have symptoms and you really need to know, you really need to answer with much more degree of certainty, a PCR test would be better.
When it comes to exiting isolation, the rapid test has been seen as a better indicator.
Antigen test is a great is a great tool because you're asking the test to tell you whether or not you're contagious, whether you're a danger to others.
So we can verify that when you need to know for certain if COVID is causing your illness, go for the PCR. But if you want to know whether you're contagious, a rapid antigen may be your best bet.
Evan Kosloff reporting for us. On top of rising cases and hospitalizations, the latest surge is also causing some uncertainty for Central Arkansas school districts. Students in Little Rock, North Little Rock, and Pulaski County Special Schools are learning virtually today. We expect updates from all three districts about plans moving forward later this afternoon. PCSSD is actually holding a school board meeting tonight to discuss COVID protocols and a possible mask mandate. Meanwhile, Jacksonville North Pulaski is on a modified schedule with only half of the students on campus each day. Cabot Public School students are attending class regularly today, and then they'll go virtual tomorrow through Friday. K-12 schools are not alone when it comes to these tough decisions. Little Rock's Philander Smith was prepared to return to in-person classes this week. That is until case counts started trending in the wrong direction. With the thousands expected to be back on campus and in the dorm rooms, the school's president says they had to make a choice to keep everyone safe.
We've been seeing quite a few breakthrough cases, even for those individuals who've been vaccinated and boosted. And so we thought we would get all of our students here, get them tested, give them an incubation period, test them again, and then we're going to start classes.
Colleges like the University of Arkansas resumed in-person classes yesterday. Leaders there say they'll continue to monitor cases and will pivot to virtual learning if they need to. And the University of Central Arkansas in Conway begins the new semester virtually later this week. Nationally, hospitals are struggling with an increase in COVID cases, staff shortages, and a national blood crisis. As of this morning, there are more than 145,000 people across the country battling COVID from a hospital. That surpasses the 142,000 record set last January. Doctors Rochelle Walensky and Anthony Fauci told senators that hospitals are struggling with both the influx of new cases as well as those staffing shortages.
Underscoring why it is so important for the unvaccinated to get vaccinated and for those who are already vaccinated to obtain the booster shot.
Hospitals are also dealing with that shortage of blood supplies. They are at such a dangerously low level that the American Red Cross has declared the first ever national blood crisis, and it is urging people to donate as soon as possible. Want to switch gears now. President Joe Biden and Vice President Kamala Harris are in Atlanta today focusing on voting rights. They're working to pass federal voting rights legislation by Martin Luther King Jr. Day, which is less than a week from now. But as Ed O'Keefe explains, it's not going to be an easy task.
We haven't seen the type of leadership that we need to see from President Biden.
Cliff Albright is co-founder of the Black Voters Matter Fund, part of a coalition of Georgia groups that say President Biden shouldn't come to Atlanta without concrete plans to pass voting rights legislation.
What we really want to see, given that he came down here, is that he's got an ironclad deal in place. Anything short of that is really going to be disappointing.
The Biden administration is pushing to pass 2 new voting rights bills, and the White House says the president today will call upcoming votes on them a turning point in the nation. In his speech, Mr. Biden will vow to defend your right to vote and our democracy, and will put pressure on the Senate to act. The first bill would establish national election standards by requiring all 50 states to offer at least 2 weeks of early voting, no excuse vote-by-mail options for every voter, a national voter ID standard, and same-day voting registration. Republicans generally oppose the bill.
They also want same-day registration, and that's just very difficult for any election official to manage. And I think that undermines trust in elections.
The second bill would update the 1965 Voting Rights Act and force states with a history of discrimination to clear any potential changes to election laws with the Justice Department. Republican Senate Minority Leader Mitch McConnell says the bill overreaches.
This is a bill to turn the partisan attorney general into a national elections czar.
So with no Republican support and continued resistance from moderate Democratic Senators Joe Manchin and Kyrsten Sinema, the voting rights legislation can't survive a filibuster vote. That means any debate over voting rights is first going to be about potentially changing Senate rules. The White House says the president today will reiterate support for changing the rules by allowing bills to pass with a simple majority.
I support making an exception on voting rights for the filibuster.
But Albright says the president needs to fight harder.
He's got to give complete, unequivocal support, demand and call for filibuster reform.
Unclear whether there will be sufficient Democratic support for this legislation as well. Another potential challenge. Adding pressure to the president, some members of Dr. Martin Luther King Jr.'s family have said there should be no national celebration of MLK Day unless Congress passes this voting rights legislation. Ed O'Keefe, CBS News, Atlanta.
All right, Ed, a heads up for you this afternoon. The IRS is warning of a tough tax filing season. It starts on January 24th, but the agency is still facing a huge backlog amid the pandemic, in addition to staffing shortages, go figure, and a lack of funding. That's why the IRS is urging people to file their returns as early as possible and to file electronically to avoid delays. This year's deadline is April 18th.